If you or someone you love is struggling with chronic illness such as fibromyalgia, Lyme disease, illness from mold exposure, chronic fatigue, or neurological dysfunction, well, I've got some good news for you. My guest today is going to explain to us how you can literally hack your brain to better health. We are going to talk about mindset and what you can start doing today to recover and reclaim your health naturally. Welcome to C60 Health Connections, where we meet with leading experts who can help you elevate performance in all aspects of your life. Today, Dr. Diane Mueller is with us. She is the co-founder of a functional medicine clinic called Medicine with Heart in Lakewood, Colorado. She specializes in treating advanced chronic conditions such as unresolved chronic fatigue syndrome, fibromyalgia, Lyme disease, neurological dysfunction, and mold illness. One of her superpowers is her mind-body approach to functional medicine, and she is going to help all of us understand how her patients utilize her Hack Your Mind program to achieve optimal health outcomes. If this sounds interesting to you, then please stay tuned because Dr. Diane is going to let you know how you can access her powerful insight on how to hack your mind for free. My name is Jessica McNaughton, and I am the CEO at C60 Purple Power and shop C60.com. I'm a business executive with years of experience in corporate America, and for more than 20 years, I've been exploring various modalities in health, wellness, and spirituality. Now, before we get started, any statements or products discussed today have not been evaluated by the Food and Drug Administration. Any products or topics discussed are not intended to diagnose, treat, cure, mitigate, or prevent any disease. So with that, we're going to get started. Diane, so great to see you today.
Oh, so great to see you too, Jessica. Thanks for having me.
Yeah, I'm really excited about this conversation. We have not had a chance to dive into some of these topics. So I know that our audience is definitely going to benefit from all of the wonderful knowledge you're going to share with us today. Before we get started, can you just tell us a little bit about your background and your personal life journey? I'm really curious what brought you to be inspired to help support people with these specific issues?
Yeah, I'm happy to. Like so many people that wind up in the world of treating complex chronic disease, I had my own journey. So a lot of my work was really based upon originally just trying to solve my own process. So started with really bad chronic constipation. And at some point I had so many symptoms that I literally thought I was dying. I was having to sometimes be carried up and down the stairs because certain days I was having a hard time walking. I was having these really crazy neurological type of symptoms where I would occasionally forget where I lived. I would lose feeling in my limbs. So some pretty scary stuff. And like so many people that go through these chronic types of conditions, I had a lot of workup, a lot of lab testing, and everything was basically normal. And it wasn't until I dove into this world of studying and learning how to work with these complicated conditions that I was able to run the appropriate lab tests to actually discover that I had Lyme disease and mold illness and a myriad of other things. And that really is where the circuit began of treating and learning and working and training clinicians then in these kinds of conditions.
Okay, well, thank you for that. So help us just understand kind of some of the basics. Like, first of all, like how common is mold illness and like how do we actually define it?
It's such a good and important question, I find, because so many people hear mold illness, and there's a misunderstanding that mold illness is a mold allergy. And we can certainly have a mold allergy. That is absolutely possible. But mold illness truly is more than an allergy. It's where we have a genetic condition. And it's actually a pretty common genetic condition. It affects up to about 24% of the population. And this genetic condition, what it does is it changes the way our immune system actually is able to recognize and tag the toxins from mold. So somebody with this condition, they breathe in mold toxins. Due to their genetic condition, their immune system is not able to see the mold toxin. And when the immune system's not able to see the mold toxin, it's not able to remove the mold toxin. So it's actually, genetically very, very, very common. And it also explains sometimes for people, a common thing I hear with mold is, well, there's no way it could be mold. There's no way I could be living in it. There's no way I could be around it because I'm sick and my spouse isn't sick or my children aren't sick. And that genetic understanding that it's not an allergy, that it's truly this genetic anomaly, really helps people make sense of how common it is and the fact that they could be living in it even if their family members are not also sick.
So now that we know kind of where it comes from, you inherited it. What are some of the common signs and symptoms, and what should people do? Like what types of tests should they be getting to try to figure out whether or not this is an underlying cause of one of the issues that they're dealing with?
One of the most, say, textbook symptoms we see with mold illness is pain of some sort. So for some people, it's headaches or migraines. Other people, it's pain that looks like, say, arthritis. But honestly, mold illness, you could call it one of the disease processes that's like the great mimicker because it has the ability to affect our hormones. It has the ability to affect our thyroid, our sex hormones, our adrenal hormones. It has the ability to affect our circadian rhythm and our melatonin. And so because of that, we can see female hormone, male hormone imbalance, chronic fatigue. We can see sleep issues. We can see menopausal type of symptoms. So there's so many different symptoms that it looks like that pain is very, very common textbook wise. But it's also something that I encourage people to think of if they've run a bunch of basic labs and they have a lot going on and they can't really get to the root cause. They don't know what it is. So it's because it's the great mimicker. It's like if you can't figure out what's going on, it's worth doing some testing. And then an answer to your testing question, there's honestly a couple different schools of thought in the profession about how we test right now. So one school of thought is by doing urinary mycotoxin tests, which is where we actually just test your urine and we're looking for the toxins that the mold secretes actually in the urine. And it's a great test. The advantage of a urinary mycotoxin test is you can get very specific about what types of toxins are actually present, and you can actually tailor treatment that way. And like any test on the market, it's really important to know the pros and the cons. So that's a pro. And we use urinary mycotoxin test. It is a valuable test. The con, though, that everybody needs to be aware of is that when we are actually finding mold toxins in our urine, that is actually a normal thing for somebody that's been in a moldy environment. So anybody that's been in a moldy environment should have toxins in their urine from mold because that's a part of how we detox those. The problem is that people with the genes, they're not going to detox fully and they're going to start storing some of those mold toxins. So the con of it, the say drawback of that test is it's not fully telling us if it's a normal part of the body getting rid of mold in a healthy way, or if it's like mold building up in the body and it's at so much of a level that it's actually pathology. So we just have to know what we're looking at and what the test is telling us.
Okay.
And then the other types of tests we can do are markers such as HLA-DR, TGF beta 1, and MMP9. And those tests are going to tell us a little bit more about having the genetics and having potential mold buildup. So they're going to be a little bit more specific to that person has the gene. The problem with that test, the con of that test, is it's not 100% specific to mold. There's a few other things that can actually make those markers change. So from a testing perspective, there's benefits and drawbacks to both types of tests. And as clinicians or as the public, if you're getting these tests, it's just important to understand what the tests are telling you and what they're not telling you.
Okay. So if you mentioned earlier, you might be experiencing these symptoms in your home, but maybe your husband isn't, and maybe your kids are. My question is, can you spread it to anybody else?
So the good thing about this is from a genetic situation, no, you cannot spread it, to other people. There is in like spreading mold, there is some level of concern, say if somebody has mold spores on their body, on their clothes, of like going someplace else and the mold spores getting, someplace else. Potentially there's some level of risk there, but that's going to be pretty minimal. The
Okay.
bigger thing with spreading is like, oh, if somebody's in a moldy house and they bring their entirety of their furniture, of everything they own to another house, it's more about spreading house to house that's a concern than
Okay.
really person to person.
Okay, that makes sense. All right, so let's talk about Lyme disease because this is such a mysterious disease and it's so complex. Do you mind just helping us understand a little bit about not only the definition, but where does it come from and how can you get it?
Yeah, so Lyme disease basically is a disease caused by a bacteria known as Borrelia burgdorferi. And classically, it comes from ticks, and ticks are the most common way of getting Lyme disease. But now there's limited research that is actually showing that Lyme, this bacteria Borrelia, can also be found in other insects such as mosquitoes and fleas. So it's not just a tick-borne disease. And the other thing to know is so many people have thought, at least in the United States, that it's really a disease of the New England states where Lyme was originally discovered. We actually now know that there's even a songbird that will actually carry infected ticks in its digestive tract. And as the songbird flies around and migrates around, it actually is releasing these ticks onto the earth. So that's part of how it's spreading, is actually through these birds.
That's
So
wild.
it's super wild. So we really need to, with Lyme, get out of this whole thing that it is just this disease of the New England states, because it's much bigger than it is not just ticks. So it's very common. And just like mold illness, it's kind of the great mimicker. So it can look like so many different things. Like mold illness, if we're doing truly textbook, and of course we're not as humans textbook, but we're talking truly textbook, one of the more common symptoms we see with Lyme disease is also pain. The difference between Lyme pain and mold pain, again, textbook wise, tends to be that Lyme pain tends to migrate. It will move. So one day it's in the shoulder, another day it's in the hip, versus mold type of pain, textbook wise, classically tends to be in the same place every day. But just like mold, Lyme disease can have all sorts of symptoms. Pain's not always present, and it can cause a myriad of widespread symptoms all around the body.
Okay. Um the the little nugget of knowledge that you dropped on me about the songbirds. I don't want people to freak out about birds. So, what do we need to know about just managing our environment appropriately? What are some, like, if we're gonna, be outside in the woods and you're walking around, or we enjoy bird watching or something like that, what should we do, just to make sure that we're not setting ourselves up for exposure to this bacteria by just enjoying the woods?
Yeah, I'm so glad you're bringing this up. It's such an important question. And as somebody that survived from Lyme disease, I still hike all over the place. So definitely encourage people. There's so many, it's so clear in research now, all the health benefits that nature provides, beyond even just like the physical health benefits from exercise. It's like just being in the peace of nature has really been shown to lower adrenaline and lower cortisol, these stress types of hormones. So the bigger thing is to still enjoy your things, and just like anything, to know certain level of risk and just protect yourself against it. And so if you're big into hiking and being in the woods, wearing natural types of bug sprays work really well. Some people will even drink, if they're really concerned about it, they will drink a cup or two of cistus tea ahead of time. Cistus is very anti-Lyme. So that's something that can be drank as a tea preventatively. And if you are bitten, especially by a tick, but if you're bitten by any type of bug, the other big thing to just know is to look out for flu-like types of symptoms, which are often the early onset type of symptoms. Lyme disease was originally thought to always have this bullseye type of lesion that came with it. And so people would just look for that lesion. And if it wasn't present, then they would think they didn't have Lyme. And it's important to realize that actually the majority of people do not get that bullseye type of lesion. So if you've been in the woods recently and you enjoy nature and you get flu-like symptoms, you might want to consider that it could be something like Lyme. And then you can just put yourself on some Lyme herbs just presumptively and proactively. So drinking cistus tea works really well. There's an herb called cryptolepis, which is absolutely amazing in the research for Lyme, cat's claw, Japanese knotweed. So just being a little bit proactive and knowing that, hey, if you have that correlation of being in the woods and have flu-like symptoms, being proactive about it. And when we're proactive and we're taking it seriously, it doesn't have to be a big deal. It's really a big deal when we don't take it seriously and it goes into dormancy.
Okay. So you mentioned that it can be spread from mosquitoes and fleas. So should we be more cautious and concerned about our pets, our dogs and our cats that are outside, and kind of our interaction with those animals that we love?
It's definitely worth considering that, yes, that they could actually be even carrying Lyme themselves. Like animals can get Lyme disease. So that is something to just be aware of. And then, of course, if your dog or animal does wind up having fleas, you want to be certainly careful about the fact that diseases can be transmitted. But I would say the same thing about that as nature. Like I love animals. I don't have any at this point in life, but all my friends' animals, like I want them cuddled up with me and all that kind of stuff. So I would encourage you not to change any of that. I would encourage you to enjoy them, to not get stressed out about them, and to just know that, hey, this is a possibility. So if you're feeling, types of symptoms that don't feel normal, just be proactive and preventative about it.
Okay. Can it be transmitted if you have it to somebody else?
From just a respiratory standpoint, no. So you're not going to, like, we're in the same room and I have Lyme and you do not, I'm not going to transmit it to you. There's some limited research that occasionally for some people in sexual secretions, it can be found, but not transmitted. So that's definitely interesting because the amount in sexual secretions is so low, it doesn't actually transmit the disease. So research looks like sexually, that's very, very safe. It's not considered a sexually transmitted infection. The one place that it can be transmitted in research that we see is through the placenta and through the breast milk. So we want to be careful if we are pregnant or we are nursing mothers. That's the area to be careful about because there is a transmission rate that can occur there.
Okay, interesting. All right, so let's talk about fibromyalgia. This is also another one of those mysterious diseases, and I know several people who suffer with it, and it seems like it is 100% debilitating when it flares up. So can you talk to us a little bit about what it is, where does it come from, and what can we do about it?
Yeah, fibromyalgia is a very near and dear to my heart kind of diagnosis because that's one of the things I was struggling with once upon a time. And it's pretty awful. The symptoms are pretty awful. And the mental component of being told that we just have to live with these kind of diseases is really, that has its own level of, rehabilitation.
It's really stressful for somebody to say that to you, that this is how it is and just accept it.
It's so lacking hope, right?
Yeah,
There's
yeah,
no hope there. So I hope then, since we're talking about hope,
yeah.
I hope to really instill hope in people in what I'm about to say, in that really part of fibro is in part that our threshold to pain actually changes. So when we have fibro and like we barely brush our hand against an object, and all of a sudden we have crazy pain. When we have those types of wild symptoms, it's in part because our neurological system has gotten rewired where our brain is actually triggered to sense pain and the body at a much lower threshold, essentially. And so getting to the root cause of fibro, and I know this is such a controversial thing to say because so many times we're told there's no cause. And anytime with fibro, we are actually finding all the various things that can actually impact our pain threshold and reverse those things. That's really where I've seen fibro disappear. And I know this is so controversial, but I have seen fibro disappear in myself and in so many of my clients that I feel very, very convinced that it's not always an easy thing to get to the bottom of, but Lyme and mold are oftentimes two of the big things that change that threshold. And if we're looking for those, as well as other infections and environmental toxins that can change that pain threshold, and actually treating those roots, we can actually see that our threshold of sensitivity changes with the fibro and make pretty substantial changes in our symptomatology through working on the root.
It sounds like what you're saying is that if you have a fibromyalgia diagnosis, then there is also a possibility that you might have some underlying conditions, other conditions or illnesses that are contributing to that, which is, increasing the overreaction, overstimulation of the message from your brain to the rest of your body and to your nerve centers. And it sounds like what I'm hearing you say is the good news here is that you can go after those other illnesses, address them, like you said, at the root cause, and that will help kind of lift up and support the body responding in a more balanced, healthy manner. Is that true?
Correct. Yep.
Okay, that's exciting. That's good to know.
Yeah.
What are some of the typical kind of signs and symptoms? I'm gonna assume it's pain, number one, but like what else is involved with a flare up or an outbreak or could contribute to a diagnosis of fibromyalgia?
Fatigue. And the other big, huge one is a huge amount of fatigue. And, between the pain and fatigue, can be pretty debilitating to even get off the couch. So those are some of the key hallmark things. And the other thing is like not having like all your common lab tests generally are checking out pretty normal. So that's the other big, big thing with fibro is in part a diagnosis of exclusion where you've done a lot of other lab testing, a lot of other things are normal. They can do some, muscle types of conductivity tests and sometimes find, some level of sensitivity and pain threshold there. But largely it's in addition to fatigue, it's really been a diagnosis of, hey, we've ruled out a lot of other things and a lot of other things you are not positive for.
Okay. Thank you. Can you spread fibromyalgia?
Luckily, no.
Okay.
Luckily, no. Yeah.
More good news. Okay. So what's an example of neurological dysfunction? And can you also talk to us about how that is defined?
Yeah, neurological dysfunction is a very broad term. So there's a lot of different things that can happen. So it could be things like what's called peripheral neuropathy, where you just lose sensation and feeling, and you can get tingling in your fingers and your toes. So that's an example of neurological dysfunction. Neurological dysfunction could be much more severe things such as multiple sclerosis. It could be things like Alzheimer's disease, and dementia has an element of neurological dysfunction to it. And a very common neurological dysfunction that we see with mold and with Lyme is POTS. It's postural orthopedic tachycardia syndrome. And that's basically you change posturally, you get dizzy, you get a fast heart rate. Sometimes you feel like you're going to pass out. And that's usually, it's seen very frequently with the Lyme and the mold and the effects of those. And it's a different form of neurological dysfunction where you're not able to properly regulate your blood pressure. And so that actually comes from the nervous system as well. So it has a wide variety of what we mean by that term. Some components that are much more, say, livable and functioning. We can function with peripheral neuropathy, obviously, much more than we can function with Alzheimer's. So there's a wide variety of what that means.
You already told us a few of these, but will you tell us what are some additional or most common signs and symptoms that people might be on the lookout for?
With neurological dysfunction?
Yes.
So anything from things like Raynaud's, where we get cold extremities and we can't warm it up, to tingling, to dizziness, like I said, to memory loss, to random pains that are shooting pains throughout our body. So any of those different types of things are big signs of a neurological issue.
Okay. And can it be spread?
No. That's the great thing about so many of these things is at least we're protecting those around us.
All right, well, let's talk about some solutions. Like, talk to us a little bit about your journey, please, and what were some of the secrets that you were able to discover that helped support your ability to reclaim your health.
Yeah, there's two overarching principles that I like people to be aware of in treating any sort of complex chronic disease. One is that it's really important to build up the body as well as to heal whatever the infection and the toxin say could be. So when we have a situation where we have a toxic overload, when we have a situation where we have infections, getting the toxins out and killing things is actually pretty hard on the body. It can be pretty depleting on the body. So it's as we are doing things that are actually killing some of the things I mentioned or detoxing, we also want to make sure we are building up our mitochondria, and that can be through using products like your carbon 60. It can be using things like NAC and carnitine, which are also helpful for the mitochondria. It can be fixing the hormones. There's a lot of different things that we can be using to build up the body, and that's really, really important. And then another thing that's super important is always coming back to the fact that with any disease process, there's a body and mind component to it. And I always like to be very, very clear when I say that. So many of us with these complex chronic diseases have been told that it's in our minds. And when I say there's a mind component, I am in absolutely no way suggesting at all that that is what I'm saying. What I'm saying here is that what's happening in the mind and the way we're relating to the disease process has an impact on our ability to heal. For example, if people do what I commonly did when I was sick until I started working with my mind more, which is like I would get up in the morning and I would immediately start doing a scan of my body. Like, how bad is my pain today? How bad is my pain today? How bad is my pain? And then what would happen is I would get a surge of adrenaline. And when we get a surge of adrenaline, that is actually not sending the right signals to our body to heal. So when I say there's a mind component, what I'm talking about is like more around doing activities that help keep the mind calmer despite everything inside of us telling us we're in survival mode and we need to not be calm because we're trying to survive. But when we do that and we learn tools and strategies on how to do that, we're actually then sending signals out from our body that's telling our cells to heal. And so that's what I mean by the mind aspect, that we can use our mind as a tool to help us heal. And so working with the body, working with the mind is very, very important.
So for so many of the people that I know who have struggled with this, it just as an observation, it seems like when they're in the height of the experience, the kind of the overwhelm that's going on with their bodies, it's at that point it almost appears like it's too late to change your mind. Almost like you have to start practicing it in advance of that particular really bad experience. Is that true or not?
It's not true at all. No, but
Okay.
I'm really glad you bring it up because one important point is it certainly can be harder to work with the mindset, but it's definitely in some ways it's an advantage to work with the mind when we are in that state where it feels like I can't do it, because if you can figure out how to do it then, you can figure out how to do it anywhere for the rest of your life.
Okay.
And an important component too with this is so many people think that work with the mind means you have to meditate. And meditation is a great thing, but there's multiple different ways into actually working with the mind. It doesn't have to be meditation. Like one of the easiest ways that I find that people with chronic disease actually respond to working with the mind is actually doing breath work, because that gives the mind something to focus on. And it's a lot easier for people to have success with it oftentimes than something like meditation. But we can still make amazing results with actually changing the process of getting ourselves out of this overdrive stress response just by doing breath work.
Okay. Do you have an example of an easy exercise that if somebody happens to stumble upon this content, they're dealing with this right now, that they could implement it in like within the next 5 minutes?
Yeah, one of my favorite easy breathwork techniques is called box breathing. So box breathing is where you make a box with your breath. So you say, usually I tell people to start with 4 for a 4 count. So you breathe in for 4. You hold your breath for 4 after the inhale. You breathe out for 4. And then you hold your breath for 4 after the exhale. So your box then is the inhale, hold, the exhale, hold, 4 count. So it's a square box. And then if you can make your box 5. So 5 inhale, 5 hold, 5 exhale, 5 hold. That's awesome. You can keep going up, making your box bigger and bigger to the max that you can do. Usually with chronic disease, I usually see that a lot of people, is very, very common to only get to 5 or 6 as far as how big your box sides are. And if you can do higher, that's great, but you can still make great progress no matter where you're at with us.
And how long should you do it for?
I really tell people that the biggest thing is more like the consistency than the length. So if you can commit to 60 seconds every day, that would be way better than saying, oh, I'm going to do it for 10 minutes as a goal. And then it doesn't, you have a day where your pain's worse and your fatigue's worse or whatever your symptoms are worse. And you're like, I can't do 10 minutes. Most people can do 60 seconds. And so I really encourage people to, pick a time that you can, even on your worst day, commit to. And if that's just one round around the box, then it's one round around the box, and that's still going to be successful and still going to move the needle as long as it's consistent.
That's really good. So when you mentioned that, the questions that you're asking yourself, you're scanning your body, how bad is my pain today? And that's creating the surge of adrenaline. What are some other questions individuals suffering with this issue could ask themselves in lieu of doing that scan that might be a more productive, kind of empowering question to ask yourself?
I love this so much. And because I think the questions that we ask ourselves really define us. So one of the things that we can do is we can certainly use gratitude as as a possibility. So even when we feel super, super, super bad, we can, if we look, we can still find something we're grateful for, even if it's the fact that we actually have a bed to lay on instead of being laying on the floor. That we have air condition instead of being in pain and having temperature dysregulation that can come with these disease processes and not having AC. So asking yourself, what are you grateful for, is a huge one. And then the other thing I really encourage people is asking themselves what they're proud of themselves for, is another really, really great question. So even if you are struggling, I imagine that you are still, if you're listening to this, you are still looking for answers. You haven't given up on yourself. If you're hearing this, that's a sign to me already that you still are invested in getting well. And so asking yourself what you're proud of yourself for, even if it's as simple as every chance I get, I am working to learn something that could get me out of the situation, and reminding yourself and changing that internal dialogue to what you're grateful for, what you're proud of yourself for, can be really huge.
Okay, that's exciting. I know we've got a limited amount of time today, so I want to be respectful of that. And I really appreciate you spending some time with us today, Diane. Can you tell us just kind of big picture, how mindset, when you really change it, when you really embrace it, how it can be a game changer for people dealing with these chronic illnesses?
Yeah, I mean, one of the biggest things does come down to when we're working on our mind, we really are changing the neurological, signals that we're sending out to our body. So by working on our mind, we are either sending out signals such as adrenaline, which can potentially have a breakdown tissue effect. And in addition, when we are more in a stress-free mental state, we tend to see more anti-inflammatory types of molecules being released in our body. So some of it is as simple as that. But another thing I see is like so many people that are struggling with mold and Lyme and fibro and chronic fatigue, all these different types of disease processes. So many people have a histamine intolerance type of reaction too, where they start reacting to almost everything they're putting in. So there's a high level of reactivity and sensitivity. And working on the mind can really actually lower that histamine response. It can lower the reactivity. And in people that are having a hard time getting well because they're reacting to everything, I've seen so much better results with working on the mind, because oftentimes when we work on the mind for a little while, then our body starts calming enough that we can then actually take the supplements that are designed to get us well that we weren't actually able to tolerate previously.
Oh, that's so cool. Well, I know that you've got a special treat for our audience, and I know you've got a hack your mind program, and you're so generous and willing to share it with our listeners for free. So, will you tell us a little bit about that? We will pop up a link to where they can access that here, and we'll also post it in our show notes. But tell us a little bit about your program and what people can expect if they go through it.
Yeah, so the Hack the Mind program is normally a $297 program that, like you said, we're giving out to your audience for free. And really love this program so much because what it's doing is it's actually guiding you through various different types of strategies like the box breathing that are designed to get your body more into that state of healing and out of that adrenaline type of state known as the sympathetic. And so, like I mentioned, there's different spokes in different ways, different paths in to working and regulating your nervous system in a more healthy way. And most of the time, people find the best compliance when they are doing an activity that they actually enjoy. So the the Mind course goes through a lot of the research on some of the stuff I'm talking about right now in a very easy to understand type of way, and actually teaches you a lot of different strategies like the box breathing. So you can then try different strategies and figure out which ones resonate with you the most and use those, pick those, because if it resonates with you and you like it and you enjoy it, you're probably going to stick with it more. So that's really what it's doing, is it's giving you a lot more strategies than what we're able to give you on just the time on the show today, so you can find what works best for you.
That's awesome. I so appreciate you doing that. Now, we mentioned at the beginning of the show that you are based in Lakewood, Colorado. If people want to work with you, are you only working with people based in the Denver metro area, or do you work with patients nationwide, and how can they find you?
Thanks. Yeah, we do work with people actually even internationally at this point. So, luckily, with our current technology, borders are no longer something we have to worry about when it comes to to helping people. So, so wherever you are in the world or in the country, we can definitely have a conversation and see if we're a good fit for you. You can find me at medicinewithheart.com, and that will have all the information, the contact there.
That's awesome. Diane, thank you so much for your time today. I appreciate all of the insight and wisdom that you shared with us. Before we go, do you have any kind of final words, for our audience, for folks that are struggling with these chronic illnesses, anything that you want to leave them with, or for them to consider before we end the show here?
Yeah, the biggest thing is the body does not say go haywire. The body does not get off track. The body does not go into dysfunction for no reason. So if you've been told you have a disease and you have to live with it for the rest of your life, it's because somebody hasn't found the root cause of the disease yet. And whether it's my clinic, whether it's a different clinic out there, what I really encourage you is not to give up on yourself. There is a reason why this is happening to you. And there is somebody out there that I truly believe in my heart is the person, the clinic that can actually help figure out that, the reason why and help you with reversing it. So don't give up on yourself. There is a reason. There are reasons the body goes offline. And I really just wish you the best with finding the right fit.
Thank you. That's so beautiful and hopeful. So thank you very much.
My
Have a great
pleasure. Thanks
day.
for
We'll see you
having me.
soon.
Bye
Bye.
bye.